Welcome to Casual Conversations. Monique, I am so happy to have you here today. Thank you for agreeing to come on the show.
Thank you for having me. I'm
And
glad it finally worked out.
Monique is just coming hot off a talk in Canada, so I do really appreciate you being here today. And we usually start out at the beginning. Where were you born? And tell us a little bit about your early childhood years.
Okay. Ooh, that was a long time ago now. So yeah, I the really cool thing about where I grew up is I grew up in Houston, Texas. That's where I was born and raised. But I spent my childhood years living in Alief, Texas, which at the time it was middle class families, but families from everywhere. Like I can't remember what the statistic is, but it's like 70 different languages and dialects represent this one area of Houston, which is Alief, Texas. And so that was the best thing ever.
Hold on, that is not my view of
Y-
Texas. So can you describe for people that don't know this part of Texas why there's so much diversity there?
Yeah, so really the diversity really kind of picked up in that particular part of town, right? Because there were houses, affordable houses, in my opinion, pretty decent, good quality school. And so I think what happened was that, and there's a very large immigrant population, different immigrant populations. And I think what happened was this is my take on it, just from, friends and, you know, neighbors and from when I lived there, is that individuals would move there. Say there's a large Vietnamese community, and a family would move there, and there would already be other family members there. And so they would move there, live with someone that you know, it could be a relative, could be a, friend of the family, and you stay there and you find work until you can move into your own home. And so that process just continued. So I mean, every I joke all the time, like every type, every nationality, you will find it in a leaf. So if you think about, like, how in the US you have the kind of these racial ethnic categories of black. Well, do you know that there are so many, like, there are tons of, black Americans that have long history lived, from Texas, Louisiana, that's there. There large Jamaican community, large Nigerian community, like almost every country in Africa, there's a Ghanaian, I mean, you name it. And then when you think about non-Hispanic white, you find Irish, you find Italian, I mean, like English, like you find everything there. And so when you go there, even today, when you go there, you'll find, just name any type of food, any type of culture, you will find a restaurant there. So it was just awesome to grow up in that environment, to have friends that don't look like you, that don't speak like you, that don't talk like you, that, I mean, and like we all got along, and it was just, I mean, just beautiful. It was like it's like the what you want, like America to be, right? And we had it in that little small community during that time point. But I do have to say that, that wasn't my entire childhood experience. So prior to moving to A-Leaf, we lived for a short time period in what's called like the Memorial Spring Branch area of Houston. So when we moved there, let me back up a little bit. So when I first started, I we lived maybe a couple of blocks from my grandmother. I'm extremely close to my maternal grandmother. I think that's where my twang, a little twang comes from, because none of my parents have a twang.
That's grandma.
So from grandma, who will, curse you out and say she loves you all in the same sentence. And we were in that neighborhood. My aunt, my paternal aunt, was around the corner. So I, grew up with my cousin. It was wonderful. Well, then after my parents divorced, we moved. I was with my mom and we moved to what's called like Walnut Bend area of Houston, which is like southwest area and diverse. I did pretty well in school there, and I mean, I would get honor roll, make straight A's, and then my mom decided to, well, my brother won't like this, but my brother was getting in a little bit of trouble in middle school. He skipped a grade. He was younger than everybody else. He hadn't, his growth spurt didn't quite happen quite yet. So, he was short and skinny. And so, he was getting in a little bit of trouble. So then that's when we moved to Spring Branch. Now, the contrast, Spring Branch was like 99% white. And I was the only black female in the entire fourth grade when we moved there.
Wow.
And it was tough. It was like, putting you, some of the kids like, "Oh, she's black. I know she can dance. Do a dance for us." Like you're some, show. And I hated it. I hated my teachers. My teachers were racist. When would know the answer, wave. I'll never forget this, waving my hand. I know the answer. Oh, stop waving your hand. You're looking like a monkey waving your hand like that. I
Mm.
mean, this is what I went through. So when we moved to A Leaf, it was just like, there's a God. Thank you. This is how the world is supposed to be. This is how, So that was the best decision. And like my grades had dropped too. Like, I mean, I was on a roll, and I think in science, and I was always good in math and science. And you probably still have my report card. I think I got a D or C or something, like really, like really bad. They even tried to say, oh, she may needs to go to some special classes, like they wanted me to go to the Sylvan Learning as if I had some kind of learning disability. It was insane. And then as soon as I moved to A Leaf and enrolled in the system there, I was back to making, honor roll every year. So yeah. So those were some bad and good times in my childhood.
And when you finished up high school, what were your plans? What did you want to do?
Oh my goodness. Well, during high school, I I thought I was going to be like the marketing director of Nike. I was such a tomboy. I was with the guys, played with the guys, dressed like, and so I was all about basketball, and I thought I was going to be, oh, I'll be the first, female that plays for the NBA. This was before the WNBA. and and so I thought I was going to be in marketing. And then during that summer, I enrolled in this summer program where we went around to different hospitals. I volunteered as a welcome desk greeter in an intensive care unit, which was tough because Often it was to, inform the family which room their deceased loved one was. So that was tough as a
Wow.
17-year-old. And so when I enrolled in college, that kind of shifted and I was like, oh, maybe medical, right? And or something in the healthcare field. So my first year of college, I just was in, a part of a lot of the different organizations, fell in love with biology, and I thought I wanted to work in the lab. But I should have known because I used to always mess up my experiments because I would talk to all my classmates and my lab partners and mess up the experiment because I was running my mouth and distracted. So I'll have to start all over again. So I should have known that I'm too much of a social butterfly to be stuck in a lab all day. But I ended up, getting my degree in biology. And after I graduated, it was so hard to find a job. It was really hard to find a job. So I felt like my degree was a waste. So I went back to my advisor and I said, I can't find a job. This is like, I have a degree and like I can't, like, and so she was like, oh, well, all you have to do is take 3 more classes and you'll have your degree in psychology. I didn't realize that I was taking all those classes for fun. And turns out that I ended up graduating with my degree in psychology, which opened up so many doors. The actual door that got me into the field of brain injury. Before I finished my post baccalaureate in psychology, I was just, I was working in the hospital. My sister-in-law got me a job at the hospital, which I loved. I was working in telemetry. They trained me in telemetry to be a monitor technician, to keep track of the hearts, monitor everyone's heart in the entire hospital, which was stressful but exciting at the same time. And so I just happened, one Sunday, I just happened to open up the newspaper just to see what's the job market look like. I mean, I was content with my job. They were paying me pretty decent. They were, supportive of if I wanted to continue my education. And when I opened it, there was an huge ad, just half the page that says, do you want to work in a neurointensive care unit? And do you have a, degree in either psychology or sociology? And I was like, oh my gosh, yes. And are you bilingual? And I was like, oh yes. And so I ended up applying, and it was to TIRR Memorial Hermann to work in the neurointensive care unit at Bentab General Hospital, the trauma level 1 trauma center of individuals with traumatic brain injury. And the role or the job was for me to essentially monitor them when they're in the neuro ICU, communicate with family for consenting, the whole consenting process, especially when someone's in a coma. That was totally new for me. And follow them, right? Follow them post injury through that whole, not everyone went to inpatient rehab. So a lot of them went home, directly home. And so I had to get in touch with them when they were at home at least 6 months or 3 months, but they had to be 6 months post injury. And the great thing about it that really opened my eyes was that I had to do home visits. So I had to go in their homes, see how they live, and ask them, about everything about their life post brain injury. And that was it. I fell in love with brain injury. This was 2004, January 12th, 2004.
That's a lot of different like that's social work, that's home visits, that's sort of medical, that and translation. You're doing a lot.
Yeah. Yeah, it was, I mean, I couldn't ask for anything else. I mean, just to like make friends with like neurosurgeons, right? Like who has friends that are neurosurgeons and you're only like, just fresh out of college. And and so, I mean, it just opened up a whole new world for me just about just this need to how can I like I've always been a helper, right? And it's always like, oh, and a connector. So it was always every time I'm in someone's home and they tell me their story, my brain is just okay. What resources in the community can I connect them with? And this is before social work. This is before
You're already doing social work.
I was already doing it. And so, yeah, I'm like forever Angel Sander, Margaret Struken, Walter High. Yeah, they gave me that opportunity and I fell in love with it and they fell in love with me, supported me to, continue my education. So I stayed there the entire time to get my master's, to get my PhD. They supported me that entire journey.
And you're connecting people with resources. When do the research questions start popping up in your head?
Oh, day one. Come on. I'm since a child, I'm always asking questions and make
Right?
people uncomfortable. Especially as a kid, right? Like when you have a kid that always asks questions, like people get uncomfortable.
But why? But
And
why?
yeah, yeah. And so, yeah, I mean, again, day one, like, my first question was, why? Okay, I saw them. They were in a coma. They came out of their coma. They, started improving significantly well, so well that they were able to be discharged home, get home. They're months after injury. And what? You don't know that you had a brain injury? Why do you not know that you have a traumatic brain injury? How can you go through all that and not know that you have a traumatic brain injury? How can your wife not know that you had a brain injury? Like everyone was like, I didn't have a brain injury. I just had a car accident. I didn't have a brain injury. I just had a fight. I got knocked out. I mean, and I was just like, why? What's going on here? Then I learned, oh, okay, well, one, of course, right? Like if you have post-traumatic amnesia, you're probably not going to remember anything that they were telling you during the acute care. And then you didn't receive rehabilitation. So none of that was reinforced about that you have a brain injury. Here are the common symptoms after brain injury. Here's what to look out for. And then, I saw how people were in the neuro ICU. The family members are like, are they going to all they want to know, will their loved one survive? So everything else just one ear out the other. So that's where I asked my first question, you know, w- what what resource, what educational resource can I develop to help them with all these common questions that they had about brain injury? If I provide this educational information, does that help improve knowledge about brain injury? Does that help reduce anxiety after brain injury? So those are my first questions, which became my thesis. And I didn't have to do a thesis. Mine, because I did an internship, I did not have to do a thesis, but
Wait. You did a voluntary
I did a
thesis?
voluntary. And not only that, it was a randomized controlled trial. My mentor was like, "Are you sure about this, Monique?" And I was like, "Yes." So do not say no. I'm doing it anyway. And Angel, supported me to do it. She was like, you have access to the patients, you have, will work together to modify an existing educational resource. I partnered with a brain injury survivor, Jason, to include his perspective, his lived experience into that educational material. I translated it into Spanish because I was like, there's no way I'm doing this without making sure that those who speak Spanish, can't receive the same, make sure that they are able to receive the same information.
And this is around 2004, 2005.
Yeah, this is 2000. So I took a year off to just work. 2005 to 2008, summer of 2008, that's when I did everything. So that's when I did my master's. So I could have finished a year and a half, could have graduated in a year and a half, but it took me three just because I said, nope, I have to create this educational booklet. Nope, I have to do this randomized control trial. It made me crazy, but
And what kind of resources were available in Spanish at the time?
oh, zero,
Right? Because
zero.
that seems to be like currently, let's put things in other languages, right? And that
Yeah.
was, almost 20 years ago now.
Yep, zero. And so for when I created, because in the educational booklet, I had in the back a resource guide of like community-based resources. And I called each one by one because I needed to know. I'm not just going to put this, you organization's name and their phone number in a booklet if I don't know that what they provide could be beneficial and that they also have the capability of serving individuals who do not speak English. And so I went through that whole list of all kinds from, how do I get help with my electrical bill? How do I get my vehicle modified? I mean, just like anything and everything that you could think of.
And how long in the process did it take you to see the racial inequities in the services provided?
Oh, day one. Day one. Day one from, I hate to say it. Day one from like, who are you really trying to, I support, donation of body to, science and medicine, but the process, right? Like the process when a loved one does not know if their loved one is going to survive or not, and just like they're like vultures, just like they're not even at the stage where they can like process information, but yet you're bugging them, trying to get them to fill out all these documents, you know, so that you can get their brain or their body. And so, um, but I would see that like with certain groups, and so that was like one. Another one is PM&R consult. Oh, I hope this may make the institution sound bad, but I think it happens
But
everywhere.
but it's universal. I mean, I say
Yeah,
universally, the color of your skin determines, a long term the kind of care you're going to get, and your proximity to care.
yeah. But I would see the disparity in PM&R consult. Like there would be a PM&R consult, but yet they haven't come to visit the patient, and then just show up all of a sudden. It's like, oh, where's so and so? Oh, they discharged already. Like, come on. Like you're gonna have to. So you're creating, you know, a lot where people are just having to go home without receiving any type of rehabilitation because you're not consulting with the patient to recommend rehabilitation.
Besides race, did you see inequities like Angela's group has seen where women were sent home and men who were considered the wage earner were given more intensive rehab or OT?
I didn't see that too much because it would always be a handful of women that I would see, especially during that time period. Because I used to say that, where are the women? I would see, domestic violence survivors, but I would not see, women car accidents or women falls, and I used to wonder, where are they? The same, like, I wondered, where are the older adults? Where are they? I didn't see them.
Because what kind of group you're seeing sort of the white male
White male,
15 to 45?
um, major or young, young adults, car surfing, getting in a fight, drinking and driving. That's who I saw. You know, attempted suicide. Those are the ones that I would see in the neuro ICU.
What was sort of the next kind of research question that you found yourself on?
So in that process, I was during the during qualitative interviews with individuals about their lived experience and recovery after brain injury. I kept hearing the same kind of theme, right? Like, the women were talking about how they didn't feel like women anymore, if they had scars or if they, part of their hair was shaved due to the surgery, scars on their face, the not feeling whole, not feeling like you're able to be the wife, be the mother, these social roles, not being able to fulfill them. And then among the men, feeling like they're no longer a man anymore. And I was just like, man, what is this? Like, what is this called? I didn't know what it was called. And it was when talking with one of my professors, and I was like, what is this? There has to be like a term for this. And she's like, oh, that sounds like gender role conflict or social role conflict. There's been a lot of, letting me know there's been a lot of work in men and looking at, studying masculinity and role changes, but not so much with women. So then that's when the light bulb went out, and I was like, I have to explore this further. So that's when the next thing I looked at. So I was interested in, and then this identity, right? Like, who am I? That was one of the top questions. Like, who am I? I'm not the same person I was before. And I was like, man, there's this change in self identity. What I need to, how does these things, this changes in sense of self identity, changes in, or this conflict, like this psychological response to not feeling like you're able to live up to these, social norms and roles that are often placed on us as individuals. And how does that play a role? Like, how does neurocognition interfere with that or, promote that? And how do they all impact adjustment and meaning psychological adjustment of, anxiety, depression, acceptance of disability? And so that was my next big question.
And you're one of the few that I find that talks about sex and sexuality and sexual pleasure. And I think, on any type, much as a brain injury, but that's important. And how does that factor into our roles of how we feel about ourselves?
Yeah, so that was great work from Angel Sanders, who's the lead on that research. And I that was really interesting, right? To hear, especially from the women. That was when I learned, oh my goodness, I never knew that for many of the women, I want to say almost all, their period stopped after their brain injury. And, some of them, it took a while before it started back up again. And I just thought that was interesting. And hearing some of the women say, oh, the doctor told me I wouldn't be able to have kids anymore, or, oh, I just completely lost, all desire for sexual activity. It just was a couple of individuals. It wasn't a lot, but there were some that, mentioned about like actual sexuality change after brain injury, and kind of struggling with like what is, was this always there and I suppressed it before, or, so yeah, really interesting work.
Oh, that's fascinating. With the sexuality piece, or with especially with the periods, I mean, that's sort of the number one thing on the PINK Concussion support group. And I don't know how we get out pediatricians, internists, and gynecologists, how brain injury affects people with ovaries, cycles. The military has protocols around hormone testing after moderate and severe TBI for male soldiers. Have you been able to figure out a way to get that message out to the community better? Or is it patient education?
There was actually a training that was developed based off of the educational booklet, the sexuality, or, sexual functioning changes after brain injury work. I mean, that's most of what we do. I would say like every project that we do, we develop some type of educational materials. Now we're starting to, right, because we educate the individual, educate the family. Now it's like time to like start educating providers as well. And so I was a part of, you know, developing an educational, I can't say it was like a webinar, it was like a online platform back when that was all kind of new, for social work, for other health professionals about brain injury. So yeah, I mean, I think I'm a health educator,
Right, right.
so I'm I'm always figuring out like how can we, uh, provide information that one can use and benefit from.
Are you surprised when you look online and say there must be a resource out there and you look and there's nothing?
Yeah, I mean, well, I mean, there are a lot of resources out there, and some of them you have to, I don't know, you know, you just have to evaluate the information. But I mean, I think in some areas there's still, not quite resources available. For example, like resources to help one with really navigating this crazy health system that we have, and a lot of the kind of rare or, you know, challenging experiences that individuals have, like really focusing. I mean, there's a lot of work on kind of like the basics, like what is a brain injury, the symptoms of a brain injury, recovery, what does recovery kind of look like for some people, but not any of this nitty-gritty, and also long term, years after injury. Like, I think there needs to be something for that phase of life too, as one ages with brain injury.
And with cultural sensitivity, what
Most
loved ones
definitely.
see, yeah,
Most definitely.
that people can go to resources and hear experts that look like them and people that are sharing their experience that look like them that they really can connect to in that way.
Yeah. I mean, I think it's I think it's really important, right? Because when I was going in and educating some of the individuals with brain injury, oh, they were just overjoyed that I look like them, and that I could relate. And then they would, you know, or just like, just to be on the same level, or in tune culturally, right? Where they could say and use certain lingo. I knew what they were saying, but when they speak with others, it's like, they wouldn't know what they were talking about. So
It's like
yeah.
they're sitting down in their kitchen talking to you like they're having a guest in their kitchen, as opposed to masking where they're in an office
Mhm.
and talking to someone who doesn't use the same language, doesn't have the same connection.
Yeah. I'm a big proponent of going into the community. Like, I know it's expensive, you know. I know people are always worried about safety, rightfully so, but that's so much better. That I mean, that's where you see everything, right? Because like anyone could say anything when you're in a clinic or in an office like this, right? But when you go in their home, you see how they live, you see what they need, the things that they're struggling with, you know, mobility, like how they move around their house, how they interact with their family members, how they interact with their children. I mean, how's their neighborhood, how's their environment, what's in the area. You can't get that when you have everyone coming into the hospital or to a clinic or to a research center. You have no clue what's going on.
So if you were in charge of the world, which I really think it would be a better place if you were in charge of all this, what would you like to see happen?
Oh my goodness. Can we please get have rehabilitation in the community? Can we have, like, I love what they have at UTMB where they have, the students involved with providing care in the community, providing rehabilitation services to those that don't have the financial means to afford rehabilitation. I mean, I just would love to see that throughout all communities. I would love to see, individuals easily being able to access or have insurance coverage, right? For them to be able to access these services, and not just for a limited time period for you know because it's not okay just to for the acute care, right? To be able to provide services and care. What about long term? What about in their community, in their homes? How do we get people to stay in their homes instead of being sent off to be, being institutionalized? Like, how do we, like, yeah, I mean, I can go on and on. There's so many things that I want to see. I want to see more, physicians, rehabilitation professionals that are diverse and that, you know, that just have that pipeline of, more diversity within the workforce in rehabilitation. So, I mean, I can keep going.
Do you see that diversity coming up through the ranks in the students that you're seeing?
Not really. I'll be honest, not really at all. More work needs to be done in that area. I teach in the PhD program. So, I think the past few years, to my knowledge, that we've only had, let's say, two or three African American graduates. I mean, I think there needs to be more diversity there. And then also, when you look at the PTOT program as well, needs more. Neuropsychology is doing better. Like you see a lot more, especially within the Latino population. There are a lot more neuropsychologists coming up and coming. Other fields, I mean, I think PM&R could do better as well. Yeah, yeah, we have a lot more work to do.
I see Linda's typing in there. Linda, have you solved this over there in maternal health?
Well, that would be a hard no. Like we've had these conversations. We've had these conversations a lot. There's so much overlap between and similarity between the conversations we're having in the maternal health care space and this space. And of course, if you look at the importance of intersectionality, I mean, there are people with reproductive capability that get pregnant and give birth that have also had a brain injury, right? So, I mean, there's people have all of these different pieces to their personality, to their identity, rather. You're Black, you're this gender, you've had a brain injury, you may be a survivor of domestic violence. I mean, there's all these different layers. And no, I was on a meeting yesterday where we were having the same conversation about maternal health and what do we do to diversify the pipeline of healthcare providers, right? And we were having this conversation also about self-advocacy and people saying, well, Black women need to advocate for themselves. Well, if you're in the middle of labor, is it really your responsibility to advocate for yourself at that moment? You need to be able to have your labor and have your baby without having to put that responsibility on that person.
Mm-hmm.
Right? And the same thing is especially for people with brain injury, right? Like how can they, if they're having trouble with all of these other aspects of coping, of course we want them to have knowledge, but to put the responsibility for self-advocacy on them rather than have it be on the professionals to gain adequate knowledge to be able to address what needs to be addressed. I have issues with that. So if anybody has, any ideas about working on the pipeline, we talked about the fact that there's been a big push for STEM, right? To get be more diverse. We need something for healthcare because we've fallen behind in so many professions.
Oh, thank you, Linda, for that. I completely agree with you. One of the groups that I'm a part of, we're thinking, or we created a group about early engagement, and we have to start early, high school, right? So, like, I participated in a program that just opened the doors for me. And so we have to engage with our high schoolers. I would even say go even before then. And like I'm planning to set up a meeting with a local group that empowers young girls and to expose them to our field. And yeah, so I completely agree with you. And then the piece about self-advocacy, oh, that just bites me when when I hear that, oh, you have to better advocate for yourself. No, well, you as the healthcare provider, why aren't you advocating for your patients? Why aren't you, so don't put everything on the patient to be able to, especially in situations like you're saying in the middle of, high stress time, expecting the patient to be able to advocate and know what they even need during that time.
And Monique, I don't know if you know Linda.
No, I don't.
Linda is amazing. I want to grow up and be Linda. Linda is in New Jersey and whole history, a life of being a midwife, and then became a social worker. Well, how old were you when you got your social work degree, Linda?
I'm not saying,
Okay.
but it was in my 60s. So I've been a social worker, and I've been a social worker. This year is 10 years as a social worker.
Wonderful.
Just saying.
I didn't really know a lot about midwives. I think I asked Linda all the stupid, don't ask a midwife all these stupid questions in our first conversation. And I've taken to educate myself, but that piece of all the different providers out there and who really goes into your house and learns about you and then can from that point help you from where you are. Nat, did you have a question for Monique?
Hi, amazing presentation. Monique was talking about being a receptionist at 17 in an intensive care unit and navigating that, and how that intersectionality has informed your very clear, wonderful, caring, present, engaged self. Thank you.
Thank you. I appreciate that.
And Monique never says no, except for one thing. And I've been nagging her for 3 years, and she is now coming on board with our domestic violence TBI task force. Everybody wants a piece of you because you are so amazing. And I just really want to thank you for all the different presentations you've made, all the different places that you've gone with us. And I just sincerely want to thank all you've given me and Aubrey taught me and PINK Concussions.
Thank you. Thank you for thinking of me. And thank you for always giving me an opportunity to share and to advocate and get others excited about advocating for those with brain injury, especially those who, you know, are often, forgotten.
What's the next? Where are you going next?
Well, two things. I'm all about older adults right now and trying to improve their care, and also looking at the intersection of brain injury and elder abuse and access to resources, and then also trying to, again, in the domestic violence, and trying to create, or hopefully we can create, better screeners for elder abuse, and look at again, the intersection of brain injury and abuse among the elderly, especially those with cognitive impairment like Alzheimer's or dementia, where it can be difficult to identify elder abuse. So that's kind of where I'm going.
That's
Looking.
New Jersey averages three contacts with the healthcare provider every year,
Mhm.
right? And what if each one of those people, and we're moving because there's a movement from screening, from universal screening to universal information,
Mhm.
because so we've changed that S in our screen, assess, facilitate, and educate to screen/share. So you're going to give information to everybody, because the danger is that if you screen and somebody screens negative because of a variety of reasons, they've not built up a trusting relationship with you, they're afraid you're going to call DCP&P or DIFAS or Child Protective Services, whatever it is in your state. And then if they screen negative, they then don't get the information, right? Because they screened negative. So making sure that everybody gets the information that you screen, so that if somebody does share that information with you, you can then talk about the how that intersects with their health, right? Which is what we're focused on. But making sure that we give the information to everybody.
We're on the same wavelength. That's exactly what our group is trying to do as well. Universal education along with the
Yep.
screen. Yeah, love it.
Well, I will definitely connect you two after this
Yeah.
call. They're both amazing connections and doing so much out there in the world. I want to thank everybody. Our New York conference is November 22nd to the 24th. Monique will be presenting. So Monique, thank you. Any last minute comment?
Nothing, just thank you. Thank you for the opportunity to share my story and my passion. for advocating for others.
Well, you're very inspiring. So thank you so much. Thank you, everybody. Stay safe. Bye, everyone.
Bye.
Thank you.